First and foremost, thank you so much. This is a new series that we're starting called Field Ready Fridays, and we will follow along month to month, quarter to quarter, with topics that are pertinent to this part of the season. So we really want to bring some value, whether you are brand new to insurance and all of this just sounds like mumbo jumbo, or you are a veteran and it's great to have some reminders. We love that. The goal with each session is to make sure that you guys are going to get valuable information on a number of different topics. So today we are going to talk about what exactly is happening right now, which is understanding Medicare's open enrollment period. How does it work? What are you allowed to do? What are you not allowed to do? How do you compliantly position yourself to still find clients, have some success? Because it tends to be a little bit of a quieter sales season. So the goal for the next hour is to really help you understand how to confidently support your clients, recognize if there are some SEP opportunities, special election period opportunities, and to continue to grow your book of business. So some talking points that we're really going to cover is I want everybody to understand that OEP is not a second AEP. All right. It is not. Really and truly, OEP was created by CMS to be a parachute, a safety net for our beneficiaries who might have buyer's remorse. Maybe they selected the plan by themselves online and they're thinking, oh my gosh, my neighbor said they loved this Humana plan and I've been on UHC and I've been fine and I gave it a chance, but I'm not really sure. CMS wanted to make sure that before people are truly locked into their plan the whole rest of the year, that they made the best choice for themselves. So what we want to focus on is this is a retention period. It's okay for inbound contact from clients or beneficiaries, prospects. If they call you, that got referred to you, you run into them somewhere. Maybe you are continuing to work the normal events that you would normally do, regular old marketing, business as usual. And they come up to you and they say, hey, I'm not sure if this plan's right for me, or I just found out my dentist isn't in network. When it's proactive, it's okay. What's not okay is to market OEP. And we're going to get into all these details here in just a second. So let's move forward into the actual basics of OEP so we know our rules here. One of the things that I want to make extremely clear, because everybody gets confused. We work in a world of compliance and so many rules. So OEP, Open Enrollment Period, kind of poorly named, right? It's not an open enrollment period. I don't know why they call it that. But it runs from January 1st to March 31st every year. And the biggest thing that you have to remember here is that the only people who are eligible to use the OEP election code to do an enrollment January, February, March are folks that are currently enrolled in a Medicare Advantage plan. So as of right this second, they are actively enrolled in a MAPD plan or an MA only plan. All right. So what can folks do? If they're on an MAPD plan, they can choose another MAPD plan. One time and one time only in that time frame. Or they can move back to original Medicare because maybe they want to supplement and they have an SEP, OEP to get a prescription, standalone prescription drug plan. Okay. But if you have a client who calls you and they only have a drug plan, that's all they have. They cannot switch. They're not eligible. So that's the biggest thing. They have to be on a Medicare Advantage plan. All right. And the way it's going to work are the effective dates. If somebody changes their plan in January, it's like normal. They're effective February 1st. They change in February, they're effective March. They change in March, they're effective April. All right. So one thing that I want to mention, especially for any new brokers on the phone, is it's really important that You leverage your point of sale to really set expectations with your clients. So we're on this retention kick, right? It's OEP. Everyone is continuing to market. They're still having events. There's still commercials. There's still things going on. You want to retain your clients. So it's really important that you set that tone of the relationship in the beginning at point of service, especially if it's a brand new to you client. If January comes around, anything feels off, you haven't gotten your card yet, you got a letter you don't understand, you need to schedule a surgery, you went to the pharmacy and you forgot that you changed plans and now Walgreens is my preferred pharmacy instead of Walmart. Anything that comes up, they need to call you first. If they get a phone call, write the name of the company down, the name of the person who's calling, and ask them for their return telephone number and what they're calling about, and call me. Tell me those things. So it's really important that we educate clients up front about how this works. I'm not just here as a one-time help you out. I'm your agent for life. I'm here to help you. I'm here to help your family. So expectations. So with that being said, I want to do a little bit of interaction here. So let's pull up our chat box. And I would like to know, I see some veterans on here. I see some new folks on here. But what's the wave of typical client questions you get the most of in January? What are they calling most about in January? Cards. They didn't get their ID cards. Yep, that's always a big one. And that's all over the place, y'all. A lot of carriers, some of them do a jam up job getting folks their cards, and some of them, these people don't get their cards till mid-January, sometimes the end of January. So it's important. That's a good point, you guys, that you are familiar with your insurance carriers and that you have a carrier rep you can talk to. Copay refreshment. Thank you, Miss Donna. Yes, when you meet them at point of sale, point of service, these folks are being read an entire summary of benefits, right? You're giving them a whole heck of a lot of information. It is very important, and we're going to get to this here in a minute, how to onboard new clients to you. Again, setting more expectations and setting up that service. But copay refreshments, reminding them, these are all the extra benefits that you have on your plan. This is how you schedule your ride share if that's available. Don't forget, you should be getting a extra spending card, and these are the things that it's eligible for. So that's a really great one to talk to people about copay refreshing. What am I allowed to do and what am I not allowed to do? This comes into marketing. You can continue business as usual. That's as simple as I can put it. You can continue to educate clients and you can continue to educate prospects. You are allowed to respond to any kind of beneficiary initiated contact. You run into somebody at the grocery store, you get a referral. You can do plan comparisons, again, when it is beneficiary initiated. Document your conversations and your needs analysis. Just, make sure that it's in response to somebody reaching out to you. The biggest thing here is, again, OEP is not another marketing opportunity in the general normal sense. You cannot market OEP. You cannot market OEP. And I'm going to dive into this for a second and be very specific. No outbound calls, no emails, no events that specifically say, there's another chance, OEP, no social media posts, nothing that is going to encourage people to switch plans. No direct mail, no deliberate OEP switch campaigns, no unsolicited phone calls, which we all know we're not supposed to do that. But it truly is supposed to be that safety net for beneficiaries. So if you're approached, if you're called, if you're referred to, whatever it may be, you cannot market and put in print the words OEP. There might be another chance. There might be another opportunity. Just stay away from doing that kind of stuff. There are plenty of opportunities. We have some agents who do a huge volume during the open enrollment period. They're not out there illegally marketing, being non-compliant. They are just continuing to be out in the community. They're continuing with their educational events. They're continuing with their tabletop events. They're exposing themselves to the community at large. And just through that, you get questions. These people are hot off getting their cards, having new insurance, having questions. I've got a surgery to schedule. Oh, I just switched. I've been on this carrier for 10 years and I just gave it a chance. This new company that came into town because it said it had it has great copays, but they're nervous about it, right? So you want to make sure that you are onboarding your new clients, keeping up with your current book. I know it's a whole heck of a lot. So it depends on how big your book is. That's why you have your sales development managers talk to us so that we can help you figure out what your specific game plan needs to be. Right now, we're just talking high level retention. How you do that retention is up to you. You might have 600 clients versus 50 clients. The 50 client agent might just need to make some phone calls. A 600 client agent can't sit there and hammer out 600 phone calls. So the game plan's got to be a little bit different. Let us help you figure out what that means for you. So again, I want to engage everybody. Can anyone give me an example of something that would be an actionable thing that violates these OEP guidelines? Cold call marketing, big no-no, especially in Medicare. Door knocking or public approaches. Yep. That's also no-nos. All right. So let's move on to how do we support our clients and really kind of dive into some more retention. We've got all these guidelines, right? The number one goal for OEP, again, is to retain your clients through service. We encourage cross-selling a good bit, right? Don't leave money on the table. There's lots of complementary products that go hand in hand with a Medicare sale. Hospital indemnities, number one. Life insurance, that's a close second. And some agents have perfected, and we're going to get to this a little bit down the road with training, but some agents have perfected that slipping it into the presentation for Medicare, and they're going ahead and getting that hospital indemnity app right at point of service. That's fantastic. But if you don't do that at point of service, you're not comfortable with it, that's okay. We're all learning. OEP is not quite the time to be calling and trying to sell when they're totally new to you and totally new to a new insurance company or whatever it may be. This is kind of a tentative time for clients. Again, like I said, they might have changed pharmacies. They're not familiar. They're nervous about making sure they get their pills on time, and they might have changed PCPs and they're going to see a new doctor for the first time. So it's not really the time to sell. So what you want to do is make sure that your clients feel supported during this time. So some best practice that we want to talk about. This is going to look different for everyone, just like I said, depending on your volume of your book of business. It's why it's important to communicate with us. We want to brainstorm. But outside of just a manual phone call or the basic elbow grease, there are tools available to help you. There's email blasting, there's text blasting, learning how to do those things compliantly. Just ask us. We can help you figure it out. Non-OEP specific communications to these people. If you're going to text or email, you can even snail mail. But again, budget. We can do things 1,000 different ways. If you've got a smaller book, that personal phone call. If it's a new to you client, a personal phone call, if you have the time and the capacity. making sure that these folks know that you truly are there for them. It wasn't just a one time I've met with you and now they never see you or hear from you again. That happens a lot with telesales. And I'm not knocking telesales. We have a lot of folks that come from that background, get a lot of knowledge and experience. But you know what? We're feet on the street. We're independent. It's really hard to compete independently with those types of huge companies. But you know, you want to make sure that these folks are getting thank you cards. It sounds so basic, right? And you're like, oh, duh. But you'd be shocked at the amount of people that don't do it. Sometimes the most simple of suggestions, like going to Dollar Tree and getting a fat stack of thank you cards, it makes a huge difference. You want to make sure your client is happy. And if they're unhappy about anything, you have to uncover that and you need to document it and you need to figure out alternatives for folks. But I love the new client onboarding with a welcome phone call and a thank you card. You know, any kind of, you know, communication around if you have any questions about your Medicare plan, I'm here to help. I'm your first point of contact. All right. So the bottom line is when a client contacts you, you have a responsibility to determine what their need is, document it, and make sure that anything that's changed is within their best interests. One of the things that is just a really great open-ended question is just what's not working for you. If you're getting those phone calls in January, just flat out ask them. Do another needs analysis. We've got tons of different types of needs analysis forms that we can give you guys for new agents, even veteran agents. It's really great to have these types of things. It's documentation. It's a reminder of things that the clients have said to you. You can file it, scan it, whatever it is. But once you figure out their needs, you can do that current plan versus alternatives, pros and cons. So, you know, I think that making sure that you have some type of map for you and your business and how you're going to communicate during these next 3 months. 30, 60, 90-day game plan. Call us. We can talk through it. Maybe your 30-day game plan is an email or a text. Did you get your cards? If you didn't, reach out to my office. Reach out to me. Then maybe your 60-day game plan is, did you know you have these extra benefits? Have you had any issues scheduling, getting your prescriptions or scheduling a surgery? Your 90-day game plan is, you know, another touch point reminder. So making sure that you're really engaging with your clients is very, very important. It's a very competitive market. There's plenty of clients out there for all of us. We don't need to take people from others. I always like to ask clients, you know, do you have anyone that's already helping you? And if they do, you know what, I tell them to give them a call. And you know what, if they're not responsive to you, go ahead and give me a call back. But there's plenty of folks out there. So you want to be prepared for a few things. Did they change their drugs? Are they having network issues? Are there any benefits that have been overlooked? We just want to be thorough. We want to be thorough. So best practice for your workflow. And if a client contacts you, we've talked about this a little bit already. Assess their needs. All right. Review those alternatives and Medicare guidelines and just make sure that they're getting what they need. I can't tell you how important that is, especially when you get reached out to by a beneficiary who maybe they're nervous about the decision they made on their own. I mentioned this earlier. Maybe they got called by a stranger on the phone or they saw a commercial on TV. They picked up the phone. They called the 1-800 number and a stranger enrolled them. So many things get overlooked. And when you're face to face with a client and you're really going through a needs analysis with them, you're imparting to that person you're educating them on what should be important to them. What should they be looking for in a plan? Oh, these are the things I need to be asking to meet my needs. So it's really important that you do that kind of stuff. All right, so targeting these OEP opportunities. I love this. Yes, there are opportunities. I know I've sat here and been like, you're not allowed to market OEP and this and that, and it's really for retention. There are opportunities, just like there is during the lock-in period. But there are plenty of special reasons, special election periods that folks qualify for. We're surrounded by them. The chronic special needs plans, typically the most you're going to find is diabetes, but there's also ones that accept folks with any kind of heart condition. There's a few that might accept COPD, D-SNP plans. There's been a few changes in the market, and we'll talk about that in a later training. States are wanting to have a little bit more coordination with the carriers who provide the plans. So they're wanting to integrate together. So some states are doing it, some states are not. So it's very important that you understand how it works in your state. Call us, we will tell you. LIS, the opportunity with LIS. I love this one. Did you know that if you have a client who has never had an enrollment application for extra help submitted, that triggers a change in status. At that point in time, they've never had a status with extra help, the government at all. They've never had a status. They've never applied, so they've never been denied or approved. That denial is a change in status, and that is how the SEP works. The special election code is approved by, oh, this person had a change in extra help status. So a lot of carriers, those enrollments that you're trying to help this person, they can get pushed through. So every human that you meet, every beneficiary is unique. They're in their own unique situation, their own timelines, their own plans, their own areas, different situations. So it's really important that you chat with us. We can help you figure out, does this person qualify for something? We've all heard this before. If you've been in Medicare, for any length of time, 10,000 plus seniors are turning 65 every single day, all the way up until 2030 something. There's folks that move. Miss Donna down in Venice, I know a lot of retirees probably want to move to Florida. We've got a lot of retirees that want to move to the mountains. Connect yourself with real estate agents and say, hey, if you've got any seniors moving into the area, let them know. Give them my card. They're probably going to lose their plan because they're moved out of their service area. So that's a huge one. Recently, the next bullet point, in the last 2-3 years, we've seen more of this than we have in a long time, which is loss of coverage or plan termination. I don't want to digress too much, but the Inflation Reduction Act really did a doozer on the carriers. Tomato, you can slice and dice it whatever way you want. But basically, it saved beneficiaries a whole heck of a lot of money. It didn't matter if you're a millionaire, a gazillionaire, or you're on the cusp of Medicaid. Everybody's capped at $2,000 max on their prescriptions out of pocket for the year. What that did inadvertently was it didn't change the cost of the drugs that were manufactured and how much they were charged, how much carriers were charged. It just put 60% more of their prescription costs back on the insurance company. So that's very basic in a nutshell explanation. So what's happened is the carriers found themselves reeling financially, trying to figure out, hey, we've got to rein some stuff in. So recently we have found that there has been a shift. Carriers are reducing the number of plans they are offering. There has been a shift towards wanting folks to be in more managed care, which is HMO plans. We have seen some of the copays go up a little bit. We've seen a big shift in prescription drugs. Prescription drug premiums have skyrocketed. A lot of carriers have quit paying commissions on those. So we've seen this happen. Now, on a positive note, those are all opportunities for you guys to get these folks enrolled into a different plan. And normally these terminations do not happen mid-year. We're well aware of them. They happen during pre-AEP, when they come out with the new plan benefits. We know before AEP starts what's going to happen. And so agents go into the season understanding, okay, I've got this chunk of clients that I'm going to have to move to something because January 1st, their plan is going to terminate. So, that's a whole nother conversation. But you also have 5-star plan opportunities. A 5-star special enrollment period is when CMS, who basically like a 5-star restaurant, they give stars to carriers. And those stars are very important. It's how the government rates them on basically how they take care of their clients, how they pay claims, the health and happiness of their member base. Lots of other complicated things go into it. But if you've been awarded 5 stars, the special treatment you get by CMS is year-round enrollment opportunities. So if you're an agent and you're lucky enough to live in an area that has a 5-star plan, at any point in time during the year, one time, any beneficiary can choose to enroll in that 5-star plan. So turning inbound questions into business. We really, really, really want to make sure that we are truly servicing these folks. It's not a one and done sale. So if service is not your jam, Medicare might not be your jam. I'm just going to be super honest, because a huge part of what we do is service our clients. And so that can get very overwhelming, right? When you've got 600 plus clients and you've got a lot of people calling in. Maybe one particular company was super, super slow with issuing their cards, like Miss Donna had mentioned, and a couple other folks. You're going to have like a flood of 150, Humana clients calling you saying, "Where's my cards?" Oh, so it can be a little stressful, but there's ways of handling this. What we want to do is we want to get to the root cause of issues with our clients, asking deeper questions, making sure that we pivot well. If they're unhappy about a certain copay, are you familiar enough with what your alternative or supplemental options might be so that you can fill that gap for them? Those coverage gaps and ancillary opportunities exist. I mentioned this, and we've got a lot of agents that make an extra 30, 40, 50,000 during AEP because they cross sell at point of service, which is fantastic. But some people, like I said, it's not your jam, and that's okay. But once we get out of OEP, or where it's appropriate, where you feel it's appropriate, if you're having this conversation and you're thinking that they're just kind of honing in on this hospital copay, they switched plans because they liked how low the other copays are. But this hospital copay with this plan I just chose, it's significantly higher than the plan I just had, and it's making me nervous. Well, are they on a zero premium plan? 90% of the time, you're putting your clients on zero premium plans, right? So they're only paying when they use their Medicare Advantage plan. All right. They're not paying a monthly copay. So they can afford a small, low premium. So it's really great to get familiar with those, complementary products like a dental, vision, and hearing product, a hospital indemnity product, cancer, heart attack, and stroke, final expense. take a look at what their max out of pocket is and what risks they have. There's a lot of folks that actually make money off their hospital indemnity plans. There's riders but reviewing these things really makes you holistically take care of your client. You can easily take a Medicare Advantage appointment and kind of turn this whole package into more of a med sup style package without the large premium. So I've got another question I would like to ask everybody. Who here, raise of hands or pop it in the chat, who here sells ancillary products? All right, Donna does when she needs to. She does when there's a need, which is fantastic. Not everybody needs it. We don't need to be pushy. Tanya said she's going to be. Awesome. Awesome. We'd love to fill the gaps. Oh, Don, he said life insurance all day long. I love it. That's music to Julie's ears. If you're interested, give her a call. All right. Okay. So let's move on to, we talked about this too. These are the options that you have. I know I said earlier that it's not really another sales opportunity, and it's not. It's not another sales opportunity to be pushy, but really think about the whole first and second quarter of the year. It's prime because you are talking to these people. So during OEP, it's good to perk your ears up. Ask those questions. Are they, is there something a gap that you didn't fill for this person at point of service during AEP? Keep that in your back pocket. It's organic that you can slide in dental, vision, hearing in hospital indemnity. But did you find out during that appointment that Miss Jones she just recovered from breast cancer? So maybe, there's a need to get the husband covered because they know what it's just cost them. They know what they've been through. They wanted her to get the best care. So out of their own pocket, they paid to stay in maybe a extended stay hotel while she was getting treatment somewhere. And that was out of their own pocket. So paying attention, that needs analysis that we talked about, keeping that information, whether you're putting that in a CRM or you're just keeping the paper, whatever. You've got the information. It's about, finding these opportunities. And the wonderful part of what we do is we earn money by helping people. These things help people. They really, really do. We have a moral obligation to make sure that they understand what their options are. All right. I'm not trying to be, pushy salesperson, but these types of products, if you really think about basic Medicare coverage, and we'll get there at Medicare 101, but basic Medicare coverage, it's 80/20. That's it. And it's only covering your health and going to the doctor, your hospital and doctor. That's it. They're not covering your prescriptions. They're not helping you with dental, vision, hearing, no long-term care, none of that kind of stuff. So these things really help people. So if Miss Jones, if they didn't have the money, she might have had to go to that hospital all by herself if her husband didn't have the money to be able to go and stay with her. So, just keep these types of things in mind. All right. So marketing ideas. All right. We're going to talk a whole heck of a lot about grassroots marketing. That's a whole nother training in itself, just like a lot of topics in here. But I kept saying, OEP is business as usual. Well, what is business as usual? Educational events, chronic condition workshops, aging into Medicare classes, community partnerships, facilitating those, popping into places, talking to pharmacies, senior centers, food pantries, health fairs. The list is endless in networking with your community. If you're into social media, posting things consistently, doing health plan checkups and, client benefit check messages. There's so many different things that you can do when it comes to getting out into the community. If you're not prepared to join your chamber, you don't want to spend the money it costs to join the chamber, that is okay. When you get to that point, I recommend it. It opens the window for you. But get onto Facebook, look for local business networking groups. They all meet usually once a month. Hand out cards, go to happy hour, do the thing, meet people in your community, get those connections. You never know who you're going to run into. And these networking events, people go to them with the understanding that all of us are trying to build businesses. And it's usually your folks that are family owned and operated. So I can't talk enough about, just because you're not sitting down face to face with a beneficiary does not mean that you are not successful, that you are not building your business. You're self-marketing, you're getting out there, you're doing the thing. You want to get to the point where some of our veteran agents that are on this training today, they don't have to do those things anymore because they did all this hard work in the beginning. Now they get referrals, So elbow grease, putting yourself out there, let us help you. We will equip you with all the professional things that you need. We've got an event in a box to make you look amazing out in the field. We can custom make any literature that you need. We can talk to you, coach you through how do I approach a pharmacy? What do I say? If I'm going to go into a senior center, what do I say to them? So we're really going to dive into this. This is what gets my entire team super excited because action breeds success. Getting out into the field and consistently being active is really what is going to start driving curiosity, driving referrals to you, creating opportunities and opening windows. We have a fantastic agent. She is in Georgia. And a couple of years ago, she decided that she was going to really dive into networking. She was going to get out every day and network. It's changed her life. It has opened so many opportunities for her, not just, getting leads, getting referrals, but building her business in other ways, meeting people that do marketing and teaching her or her paying them seasonally to do things for her at low cost, meeting folks that create flyers and things. I mean, there's so many benefits to doing this. So I'm very excited to get into grassroots marketing at a certain point. Brand building during AEP, it adds value, creates a referral pipeline. You can get your digital presence improved. You can get yourself prepared for all those cross-selling opportunities. As we wrap up, remember, I know I probably said the same thing about 50 times, but sometimes with trainings or conversations, you have to. OEP is a service season. There are sales opportunities to be made in the correct way. The agents who really thrive during this period are the ones who really dive in and embrace that retention aspect. They handle the SEPs in the correct way and they stay active. So if you're one of those agents that, they go, I used to laugh before there was OEP, literally agents fell asleep from January to March. But OEP, that's not possible anymore. People are calling. You want to protect your book from the continuous commercials and telephone calls they're going to keep getting. So some action items. Prepare your OEP response scripts. Talk to us if you need to. Review all your AEP notes. Is there anyone that you really need to be following up with? Is there somebody that stuck out that maybe you didn't feel like they were really getting what you were picking up, what you were throwing down, and you should follow up with them for retention? Make sure you understand your SEP and cross-selling opportunities. Make that list. If you did that needs assessment, you wrote down a note that Jane had cancer. Okay. Again, that's making your list of clients that you're going to call in and want to speak to about maybe a cancer policy. So reviewing that data, make sure that you're engaging in your community. get out there, do 2 to 3 community partnerships in the first quarter. We've got some folks that I would love to have hop on this webinar. They're jam up. One spent 13 years in construction sales, and she's applied that community outreach knowledge directly to her insurance business. You do the same things, it's just a different product and a different demographic you're going after. And it's been hugely successful for her. I've never seen someone fill a calendar up in my life. It's overwhelming. So make sure you're thinking about that. If that's in your wheelhouse, if that's the point in your business that you're at. Again, veterans, if you're out on here and you're soaring high on referrals, God bless you. You've made it. You've made it. You did all this hard work already. So here's our SD team. We've got Julie, Angie, myself, Danielle, Titus, and Alec. This is our full support team here at NCC. And everybody on here is assigned to one of us. And when I say assigned, we have to do that for, just organizational purposes. But if you can't get a hold of your sales development person, I guarantee you it's because they're in a meeting or on the phone, and they'll call you back. But if it's extremely important, any one of us, we're all here to help. We are all here to help. So does anyone want to unmute and have any questions?
Everybody has the option of, on the bottom of your dashboard, there should be a little microphone. If you click on that, I've turned everybody and allowed you to come off mute. So all you have to do is click that microphone and you can come off and ask any question or give any pointers that you may have. And so, Ms. Julie, I think you were talking and I interrupted you. I'm so sorry. I will turn it back to you.
That's okay. I just want to say, I've been an agent for about 30 years. And one of the most important things that you can do for your customer is the needs analysis and uncovering the insurance needs, because they may not know what they need. And cross-selling is so important because the greatest risk that they face in their lifetime is a healthcare issue. As a nurse, respiratory care practitioner, I've watched hundreds of people lose everything without having insurance. And most people don't know what they have. The policy goes in a drawer, it doesn't see daylight till they need it. So the best thing you can do is educate your customer and cross-selling.
I love that, Julie. Thank you. I mean, it's real life. I love the fact that what we do is truly a service to people. It's not something that we usually have to convince people that they need. Everything is beneficial to them for the most part. So for me, that's just such a feel good that we can go out and educate and service our community and make a great living while we're doing it. I love that. Does anyone have any questions?
Hello, Julie. Lorenzo McDonald here. And this is my first meeting. I'm joining you guys. Great presentation here. I had a two-part question in regards to finding out if a client has moved out of their area. And also backing up that question is how do we find out if our state is a 5-star enrollment state or 5-star enrollment period state?
Okay, so part one, there is no list per se that you can purchase that tells you that people are moving or losing coverage. How you find those people is through partnering with local real estate agents and agencies. They're the ones who are getting directly connected to the folks moving into the community. And what happens when you're on a Medicare Advantage plan is your plan is only good for the service area in which you live, where you're domiciled, right? So when we're quoting them with their zip code, and they can only enroll in the plans filed in their county of residence. So when they move from Pennsylvania to the mountains of Georgia or down to Florida and by Donna and Venice, they're not going to be eligible for that plan that was in Pennsylvania. And so if you're educating real estate agents and agencies and saying, hey, any seniors that are moving in here, they're going to lose their health insurance. Give them my card. And if I know of anybody, I'm going to scratch your back. It's creating referral partnerships. Does that answer that, Lorenzo?
Partly, I think I kind of understand that it's based off their zip code within their county. So if they move out of their county to another county within that state, would that qualify for them to be out of the area?
Yeah. So the SEP for moving, it depends though. Every plan has a service territory. All right. So you might have plan ID number H5521-001. You'll get real familiar with all these numbers and letters. That plan might be available in the Tri-County area. It could be a plan that's available statewide.
Okay.
So it's going to very much depend. So for me, my advice is when you start to sell Medicare and Med-Sups, identify what your service area is first. Where am I going to sell? And once you identify that, either call us, or it's very easy to actually get on Medicare.gov, pretend like you're a consumer and punch in zip codes. And it tells you every single carrier that's available in that region. And make sure that you are licensed and contracted and certified for those companies so that you are competitive. You've got what's available. Now, I can tell you that nationwide, Medicare is so different. California Medicare is completely different than Georgia Medicare and completely different than the plans available and the style of plans that are in Florida per se. There's regional hospitals that create these little micromanaged Medicare Advantage plans. And some of those we do not have. Like you have to live in the state to even have access to those plans. But just talk to us. We'll help you figure it out. Does that answer?
Yes.
Okay, awesome. And then what was part 2? Oh my gosh. What was the question?
Yeah, the 5-star enrollment period.
5-star. Medicare.gov. That's your quickest way. Medicare.gov, put in the zip code. It will tell you the star ratings. Again, there's really no list out there that you can get. Well, actually, I lied. I'm going to make a promise to everybody on here. CMS, the Center for Medicare and Medicaid, they issue a spreadsheet that actually gives you the full list of 5-star plans nationwide. I will email that to everybody. I'm going to write that down. So you'll have that available to you. So if you are someone who sells over the telephone, maybe you do digital leads, whatever it may be, you'll know nationwide all of those 5-star plans. I might actually have it downloaded already. I think I do. 5-star plans. All right. Does anyone else have any questions? Let us know if you need anything at all. And again, if you are interested in ACA, please reach directly out to Danielle. If you're interested in life insurance, reach directly out to Miss Julie. Otherwise, the rest of us focus on Medicare and ancillary. So just reach out to your person and let us know if you need anything. We are at now the top of the hour. So thank you so much for spending your Friday morning with me and the rest of us at NCC.